Welcome to the New to Medicare Policy webinar. This webinar is designed for those that are under 1 year of Medicare experience or wishing to review the basics of policy. The key thing to keep in mind is I did mention the basics. So it's designed for really high-level beginner information. My name is Tom Ryan. I'm with Provider Outreach Education, and I'll be your presenter today. I am joined by Karen Curtis. Now, Karen's job today is to monitor that chat, ask technical questions. You'll hear her later, time permitting, asking questions of me that you guys put in the chat. So there's a variety of different things you want to be aware of. Let's get started with some basic information from our disclaimer. First, many of you who have been with Medicare for any period of time, and this could be under 6 months or over, will know that Medicare does change often. There's a variety of things that go into effect. What's great is with the new to Medicare, the policy information, the basic information hasn't changed in a few years. This does not mean that it couldn't change. So I'm going to give you the information that is current as of today, and we'll look at more of that information and where to find that as we get into exploring some of those resources later on in the webinar. I did prepare responses to questions, but they're based on the facts that were given. Some of the questions that I was asked, I don't even have enough information to give you a full response. And so I'll also indicate those as well. But again, please put those questions in the chat. We would love to get those from you and then be able to answer those as time permits or be able to email you with a response. The last item I just want to briefly mention is that, again, CMS does prohibit the recording of a presentation for profit-making purposes. We don't know how you're going to use a recording, so we ask that you don't record it at all. Instead, we've chosen to record it, and we will load it to our YouTube page, and then we will load it into the Encore section of our website. So the Encore will be there for 60 to 90 days on the website, but it will remain in the YouTube section Encore list for a longer period of time. I just asked Karen to place that into chat for me. All right. Agenda. What is our goal for today? Our goal is to provide a high-level understanding of Medicare policies. Remember, this is not specific to a certain policy. Instead, it's the policy types, how to create them, what are the processes, what do you need to understand about Medicare policy? So again, as a new to Medicare information, I do want to encourage you to add questions into the chat as we go. I think this will help you versus trying to store it in your head and getting a little bit confused or forgetting what you had as a question or whatever. So if you put them in chat, we can always come back to them. And I will stop at periodic points for questions. So I want to make sure you're aware of that. So it's not going to be just at the end. When we begin to work with policies of any kind is to give you a definition based on CMS. So again, this section is designed to provide the definition, but also it's to provide you that basic information. My goal is to help you have an understanding of some of the basics so that when we get to the rest of the information within this training, you're able to understand what you need. So again, keep in mind, we're going to high level basic this information, okay? We'll talk about some of those basic informations. One thing to begin with is what does Medicare cover? What is Medicare limited to covering? And this is actually in the Social Security Act, and we'll talk more about that. But it has to be medically necessary. So Medicare coverage is limited to items and services, 1, that are medically necessary, 2, that are reasonable, and they have to be for the diagnosis or treatment of an illness or injury and within the scope of a Medicare benefit category. Now, the reason that they say and within the scope of a Medicare benefit category, this would incorporate things like preventive care and other types of things that may not be for the diagnosis or treatment of an illness or injury, okay? So a policy is then used to help you define what Medicare will consider under coverage limitations. So what diagnosis codes go with what procedure codes to make it covered today? What are the basic criteria, written out criteria that will help support the evidence, the medical evidence through various published information to show us what Medicare will consider medically necessary. So that's really what a policy is. With that said, do want to answer our first question, and our first question is, does every single type of service have a policy, whether it is a local or a national? And we'll define those in just a moment. And the answer is no. Not all services fall under what is termed a policy. Now, they may have coverage limitations in the Social Security Act. They may have them in the Medicare day-to-day operating instructions, known as the Internet-Only Manual, or in other CMS guidance, but they don't necessarily have to have a policy. So with that said, we will first then move on to two different definitions you need to be aware of when we talk about policy. Now, these are the formal policies. First is a national coverage determination. This is an evidence-based policy, and it is covering reasonable and necessary services. This means that it is a national policy because it is written by the Center for Medicare and Medicaid Services, which means that it applies to all states and territories that Medicare processes claims for. When we look at this particular information, this is an overriding piece of information. The only thing that may override an NCD would be a law. The Social Security Act would be an example of that, or any other law that may change what happens within Medicare. So NCDs are the big overriding policies, if you want to think of them that way in terms of the formal policies. Key things, they are written by CMS and they do define medical necessity, but they don't give you coding and billing guidelines. So that's where that information will come in a little bit later, and we're going to hear that termed as a local coverage article or a billing and coding coverage article. LCA, sometimes people will refer to it as. It's a supplementary document to help you understand the billing criteria for our system related to an NCD. Okay, so when CMS says, or when people say, what else is there then types of policies? You mentioned a second one. The second policy is going to be called a local coverage determination. Now, very similar to a national coverage determination, it just uses a different process and written by a different person or entity. The local coverage determination is evidence-based, and I'll define for you on the next slide what evidence-based actually means. But it has to cover medically reasonable and necessary services. This is written by one or more Medicare administrative contractor. A Medicare administrative contractor is the claims processing contractor. So they're the ones that work with everything related to claims, from provider enrollment to appeals and everything in between, which incorporates processing a claim, which is where the policy, the LCD, falls into. Keep in mind, this is a separate section under the law and allows for this to be in place. This particular LCD only applies to selected states and territories. So what I did on this slide for you is I gave you a little map, and it's called the AD MAC jurisdiction. So for instance, WPS, we would be J5 and J8, which is Iowa, Kansas, Missouri, Nebraska, and our national contract, and J8 is Indiana and Michigan. So on the map, it's yellow and the dark green. Our policies only apply to those areas. Now, this doesn't mean we couldn't join with another MAC who's having similar or other issues. Sure, we could. So you may say that our policy published or our policy shown applies just to us, but it's exactly the same as like a Noridian policy or a CGS policy, a Palmetto policy. And that's okay, we can do that too. So remember that a local coverage determination is simply written by the Medicare administrative contractor or a group of them. A national coverage determination is written by CMS, therefore it is the overriding one, the bigger one, if you want to think of it that way. Evidence-based. So I used this term for both NCDs and LCDs. Please get used to those two acronyms, NCD, National Coverage Determination, and LCD, Local Coverage Determination. So evidence-based in general terms means that it has to use proven medical services. Proven medical services are something that are approved by the FDA and must be supported in medical journals by medical experts and with standards of medical practice. This means there must be some studies done, there must be written evidence that this works for the condition that it is covering. As a matter of fact, if something comes up, we can actually make a list of a non-covered LCD and say, this doesn't support it, but this does support it. And we do that using procedure codes and diagnosis codes. And we'll talk more about that in a little bit. Now, when we do make anything into a coding guideline, which I'll talk about in a moment, All of the written information to support that coding guideline must be contained within the policy. Again, whether it's an NCD or an LCD, it doesn't matter. That will explain the rationale, explain why something is being done in the way it is done. So we have to then look at that. So what does that mean for you as a provider or you representing a provider? You must look at the information in the LCDs, the written information, and then the documentation written by your service provider, whether it's a doctor, whether it's a PA, whether it's an NP, must support the criteria listed within the NCDs and LCDs. This is part of the documentation requirements. So that's why policies are put into place, okay? Making sure that we have all of that. So those are the two types of policies. One thing I have talked a little bit about already, and again, I'll talk about it again, local coverage articles. Now, a local coverage article is simply the coding and billing guidelines. So it could say, these diagnoses support this procedure code. These diagnoses do not support that same procedure code. Medicare will require a certain type of modifier on the claim. But again, all of the information must be supported in the documentation. You cannot code something from the LCA that is not in the coding and billing guidelines, okay? So there's a variety of different pieces of information that you do want to look at when you're looking at all of this together. Now, I will eventually get to the point where we're at a point and I'll show you all of these pieces and we'll talk a little bit more about that. But I just want to get you some of those basic definitions right now, okay? One other item that you're going to hear me mention frequently as a basic definition is the Medicare Coverage Database. This is on the CMS website. It is available for you and us. The Medicare Coverage Database is a national storage system, national storage area. What it does is stores anything related to a policy, whether it is an NCD or an LCD. When I say anything, it can be everything from a draft, something that isn't finalized. It can be the evidence that we're using to support it. It can be comments that you gave and we responded to in the process of developing it. So this Medicare coverage database is going to have a lot of information in it. So we do want to make sure that you are aware of that. And again, I'll show that to you. I'll show you that big database storage in just a little while, but I don't want you to not be familiar at least with it in terms of that type of information. All right. If you look on my slide, you will see, and you can, if you print these slides out, you will have a link right here, and I'm just going to open it up. And what this link will do for me, or should do for me, you can see it gave me a little blue indicator there. It should open the Medicare coverage database directly. Now, anytime that I'm mentioning a resource, it should do this, and it did not. It should automatically open it for you. There we go. Sorry, it's just taking a long time. And so I'm not going to use a lot of those links. So I'm going to find it easier to navigate. But this is what the Medicare coverage database looks like. Again, we'll look at it a little bit more. This is the search page, which is also your welcome page, and it will help you walk through all of these things. Select states, specific information. You can put contractors, keywords, whatever you want to do in here. So we'll look at this in just a little while. But I wanted you to be aware of what those blue and underlined are. If you're not familiar with using PowerPoint in that manner, please know that I did give you all those different resources linked in that manner. Which brings us to the first set of questions. And the first set of questions we're going to relate to just to the definition section. So I want to talk just briefly about that. I will give you the opportunity to put anything you have in chat. I will let you know that I do have two questions that I think are relevant to this section before we move on, before we open it out for questions. So the first one is an LCA only for an LCD, or is it for an NCD? And the answer is it's actually for both of those. An LCA, remember that's the coverage article, can be written for an LCD, can be written for an ACD, I'm sorry, an NCD, but it can also be written for a general broader spectrum. Now, when we say that, could an LCA be written based on the law or based on the internet-only manuals or those day-to-day operating instructions? And the answer is absolutely. So LCAs, those are coverage articles about coding and billing. Those are a bigger, broader source than a policy. So while they tell you what our system does, they aren't just related to policies. However, many policies do have them. Next, are all services subject to an NCD, LCD, or an LCA? And the answer is no. If we do not have a policy or a coverage article, we don't have anything on this, then any medical reviewer has to look for medical necessity. And this is under section 1862A1A. And what they're looking for within that documentation is, why is it being billed as medically reasonable or necessary to treat that patient? Some people will say reasonable and necessary, and either way you want to look at that is correct. Now, I use or sometimes to simply indicate that, like a preventive service, it's reasonable, but it might not be medically necessary. So please feel free to, look at that and explore that a little bit more. Karen, did we have any questions added to the chat so far?
Tom, we haven't had any come in quite yet.
Okay, thanks. Everybody keep those questions. If you have them, put them in the chat right away. Let's get those answered. But otherwise, I'm going to go ahead and move along. Next, we do want to talk about the processes for an NCD and an LCD. The reason that I'm incorporating this information is because they are slightly different. As you can imagine, when CMS writes theirs, again, NCDs overriding LCDs, they do look at things a little differently, and they have a little bit of a different process. Now, let's talk about that NCD process first. And the first item on this slide, you can make a little note if you want, or you can highlight it, whatever you want to do here. It's request from interested parties. And this may be an optional step. While it is how it normally starts, there are times when an NCD may start on a different purpose. For instance, a new technology that's been established for 4 or 5 years, and there's a variety of different LCDs out there. CMS may choose to write an NCD covering it on a national basis, and what's that's going to mean for everyone. But it was a different technology. So that's how an NCD can get started. On the other hand, someone can actually request it. And the key thing here is you'll see the word interested party. Interested party is not just a provider, though it can be one. It also could be a technology company. It also could be a patient or a beneficiary. It also could be someone acting on behalf of them, a lawyer or a legal person. So a lawyer or a legal person could act on any of those interested parties. So it has to come in from an interested party. At that point, CMS staff will enter into discussions. And what they're looking for is, what is the evidence? Is it supported? Is it a high volume service? Is it something that we need a policy for? Other times they'll enter into discussions and look at data and determine that this isn't billed very often. There's no problem with it. It's being paid correctly. So a policy isn't really needed. Now, let's say that they do, after doing the discussions, looking at the evidence, looking at all of the information, they do decide that there is a policy needed. They will draft one. This is a very simple process. They write it out. Well, I shouldn't say simple. Sounds simple, right? You write it out, sounds real simple. It's not that simple. They have to go through and incorporate all the evidence, explain what the evidence states, show you why or why not it's covered, in a variety of other things. Now, keep in mind, when they draft this policy, they're not going to put anything in there related to coding, billing, or systems. That's going to be our job later. Okay. Once this is done, CMS then sends it to the Medicare Evidence Development and Coverage Advisory Committee, or MedCAC. So this is a group of independent guidance and experts. Their job is to look at it for CMS and to provide any clinical topics, any kind of information they may need. This is where you talked about, remember, studies came in and talking about the experts or the people that actually work with it. This is the people that may actually work with it. So they are supposed to provide an unbiased opinion, current deliberations, state-of-the-art technologies, other things like that. So CMS is aware, hey, there's this new technology coming out. Hey, there's a new one coming out even after that. This is what's going to affect that. That's what we use this information for. Now, the MedCAC will review and evaluate all the medical literature, any technology assessments, any public testimony, or examine the data and the information from the benefits. They are assigned to look at any harms this could potentially cause a beneficiary by limiting coverage or adding coverage. Also, the appropriateness of medical items and services under the Medicare guidelines. So there is a variety of things they're looking at. They also then want to judge the strength, the available evidence, to make sure it meets the Medicare criteria. We don't want this to be something that's just out there and doesn't really work. So how does CMS do that? They'll use 100 or more people. So they up to 100 people. I'm sorry, 100 or less experts. Try that again, 100 or less. And they use clinical and administrative medicine. They use biological and physical science, public health administrators, patient advocates. So it's a huge number of different people. They put them together and then they select about 15 members. So they start with a big group and then they bring it down. Their knowledge is what is used to really try to hone this in and to make it practical, workable. Now remember, some people have said, well, it doesn't work for me in my area of the country, but it does over here, or it's good in this, but not. That's because this is a national policy. So those members must then determine all of that type of information, okay? The panel meets in a public forum, so it's approximately 4 to 8 weeks over the life of the committee. They look at evidence, they deliberate everything, and they talk about it. The key thing there is it is a public forum. So that forum then allows you to listen in and hear things and know what's going on, okay? Then there's also a technology assessment. This one's a little bit different than the MedCAC in that it looks at a committee that looks at technology, what's currently changing and what's happening when they develop the policy. It's just a slightly different forum, but they do have to look at whether that technology works better, replaces, or will add something to the care of the patient in the long run. It's not just about whether it's a new technology that's great, amazing, and it's being promoted a lot. What will it do for the care of the patient? What will it do to help enhance Medicare? Patients' lives, ability to treat whatever they're looking at. So there's a variety of factors they're going to look at. CMS will also open it for public comment. And as you can imagine, this is a comment from anyone about any reason that they feel it should or should not be covered. Then before they finalize it, they'll issue a final decision memorandum and implementation instructions. So this memorandum is issued, it's going to give us the dates, it's going to be effective date, the final coverage, all of that will all be issued in this memorandum. And then contractors are expected to issue the edits related to it, which would be also part of an article if there is going to be an article related to it. So there's a variety of factors that come in. Now keep in mind, a lot of times the memorandums are issued and the implementation date is actually later. So this is when the coverage will begin. This is the implementation date. And that's done to allow for the systems to be updated, all of that. Other times the memorandum may not be effective until the implementation date. So they could have a couple of different things going on there from CMS. So that is a brief summary. Now, as I said, it's very brief, it's very high level. We didn't want to get into all the in-depth details of it because it is quite cumbersome when you get any more down into the weeds of it. Let's move on and talk about the LCD. Now, I can see I put a little flow chart on there. It's going to go through exactly what I'm going to talk about here. First, I want to let you know that an LCD process is available on our website, but it's also available in the day-to-day operating instructions, the program integrity manual. We can talk more about that, and I'll give that to you in just a little while. But so we don't get to make this process up. This is established by CMS to help all of the contractors. So first thing, we can take a request from an interested party just like CMS. Can being the operative word, it doesn't begin that way always, but it always has to look at data analysis. Even if a request comes in and you're asking us to look at an LCD, we do have to do data analysis. The data analysis must then support that there is something going on that an LCD would be needed, whether that is a claims issue, whether that is not being used the same way throughout our jurisdiction, whatever that happens to be, that's what we're going to do. Next, policy nurse, actual registered nurse at a minimum, is assigned, and they have to research. Now, when we say research, that's those medical journals, that's all of those different pieces of public standards, all of that different type of information. They may actually reach out to certain medical professionals within the community to determine whether or not this is a good idea. You know, how will this affect? Once they've done their research, they'll then move on to drafting. Again, this is just simply writing the policy. Now, when they draft a policy, they could also draft, when they draft the LCD, they could also draft the coverage article. The coverage article doesn't have to go through the same review process because it's not the policy, it's not the formal limitation. The coverage article is a little bit of a difference. So when we hit once the draft happens, it doesn't have to go through the public comment and consideration. I just wanted to make everyone aware of that. Once we draft an article, and this is our RN staff and our doctors, they do have to enter it into a public comment period. The public comment period is not just one thing. The public comment period contains 3 separate items. The first one is the Contractor Advisory Committee. This is a group of doctors, medical societies, hospital associations, technology people, all of those different people that could potentially be affected, including the patient or beneficiary, have the right to be on this CAC. And their job is to simply look at it, to review it, to read through it, to rip it apart and say yes, no, good, bad, all of those different things. And believe it or not, they actually do that. They take this job very seriously because this limitation will also limit them. Now, along with those particular group of experts, we also have an open meeting, and this one is for anyone from the public to attend. They can make any kind of comment they want on the policies that are up for review. And so we do take those into consideration. The last form is to write in to us, and that written information comes in via email, and then we have to consider all the comments. So it doesn't matter where the comment comes from, we have to consider it. Now, at some point, if something changes during the consideration, we will never make it to the publication. Because let's say technology changes, let's say something like that happens, we can actually retire a draft policy before it becomes final. That will happen if something changes and there's no need for it anymore. Or if during the public comments, all those different comments that we gathered, we find out that this won't do what we think it's going to do, or that it's more effective to do it in a different way. If, on the other hand, that's not the case, and we do finalize it, we will publish it on our website. Publish it in the Medicare Coverage Database, or the MCD, and link it to our website. That's where the publication comes in. Once it's publicly available, it will not be active, which means we cannot turn the edits, the audits, or anything else related to this on for 45 days. So we publish it, and then there's a later activation date. Why do they do that? CMS instructs contractors to do this to allow you, the provider community, to be ready. If you're not ready, it can change how you think. So you want to make sure that you're aware of that. Now, again, if we publish an article, it can be related to an NCD as well that does have that activation time. We have to publish it. We can't just turn it on today. We do have to give you notice. But the article does not have to go through all of these different processes because it's not about limiting coverage. Instead, it's about what's going to happen in the system and what you need to know to make sure that you're meeting the system requirements, where the policy itself is about the medical necessity requirements. Hopefully you understand that. One thing I just want to mention is no NCD or LCD is ever final and done and complete. That means that there can be changes made to them through various processes. They can go back through the review process. You can request a review. We'll talk more about that in a little while. But just because there is an NCD or an LCD doesn't mean that it will never be changed or that other things can't happen. It is effective, has a current and termination date. It also can have a current and change date. So a variety of things can happen with both NCDs and LCDs. So when we talk about WPS, again, I did mention this earlier, but I just want to remind you, and I put this into a slide so that you have this information. We are a Medicare administrative contractor. This means that CMS uses jurisdictions to divide the country. Our current jurisdictions are Iowa, Kansas, Missouri, Nebraska. And there are some J5 national providers. These providers do submit on a UB04 claim form or 837 electronic transaction. They are all part of the Jurisdiction 5 contract. There's also the Jurisdiction 8 contract, and these are Indiana and Michigan providers. So when we look at our policies, this is who they affect. We did talk a little bit about this slide, but I do want to add this one in just as a reminder. More than one jurisdiction can join together, and they join together, one jurisdiction will take a lead. What that means is they'll write the policy, they'll put the research together. Then there's an extra step in there because then it has to go to each Medicare administrative contractor that could potentially have or be affected by this. If it meets their information, then each Medicare administrative contractor has to take it to their to their open comment period. Remember, that's those 3 parts. So this is not about like it's just one or the other. Each contractor still has to continue to do it. They could do it on an overall basis, which means, hey, we're just going to hold one open meeting. We're just going to hold one CAC about this, and we're just going to do this in one response document. All of that is perfectly acceptable. So that's what multi-jurisdictional means, and you will on occasion see that. All right, let's move on to the next question and answer section. Again, if you have questions, put them in the chat feature. I'd love to hear from you. In the meantime, we have some that we are going to get to, and this is where we're going to answer some of those individual stuff. So, does an LCD, NCD override the other? So which one overrides? It's always going to be that NCD. Remember, an NCD is a national coverage determination written by CMS. Now, an LCA is a coding and billing article. It's not necessarily overridden by an NCD. On the other hand, it supports both an NCD and an LCD because it provides system clarification on what our system is looking for. So when you look at that information, you want to be well aware of what you're doing there. The next question is, are NCDs and LCAs binding? Yes, they are binding. What does that mean? It means that they will talk about what Medicare will consider medically necessary for a service that is being billed. When we say talk about, it's written information. It is not the coding information. That's the LCA. The LCD itself will only talk about the given information. Okay. Is there a place I can locate some reconsiderations? And the answer is yes. And let's show you a little bit of some of these resources at this point. And we'll, at just a moment when we get into the next section, which is all about resources. So yes, the reconsiderations are done slightly differently for an NCD versus an LCD. So I want to make sure that you're aware of that right up front. But again, that's where I talked about it's never truly final. Now, the next question I want to relate back to that reconsideration because they asked about an appeal of a claim based on an NCD or an LCD. And the answer is yes, you can appeal claims. These are medically necessary denials. If you feel it's medically necessary and your documentation supports that, LCD and NCD denials will allow for appeals. Now, again, it's the normal 5-level appeal process. That does not change. That is a separate process from the LCD or the NCD reconsideration process. So if you want to change a policy, you have to do the LCD or NCD reconsideration process versus the appeals process for a claim. Let me know if that didn't make sense. I can definitely do a better job of explaining if you feel like it's needed, but put that in the chat for me. So, guidance on policy resources. This is what we're going to get through in the whole next section. So if you still need guidance on policy resources or you still want some more information, I really do recommend that you pay attention to the next section. Also, if you still have questions, put those in chat. I can help you more. One thing that I did mention is draft policies. And so they asked, is there a section on your website where we can locate those draft policies? And I want to make you aware that yes, there is. It's might not be exactly where you think it is, but I will show you how to do that. I'm going to rely on Karen that if I don't, she's gonna remind me on that one. So draft policies are important. They do give you the opportunity to comment on them, and I really think you should take a look at those. All right, Karen, do we have any questions in the chat so far?
We have not had any questions come in, Tom.
All right, well, let's move on then. Next is going to be resources. This is one of the important areas that I think you really need to pay attention to. As I mentioned, there's a variety of different things and factors available to you to help you through the process. But of course, my first one, I've mentioned it a couple of times, I showed it to you. It's the Medicare Coverage Database, or the MCD. Let me show you this database again. I just think it's really important that you're aware of it. So a couple people have said, what's the easiest way to find this? I'll tell you, if you're on the CMS website, cms.gov, you can go to Medicare, you can go to coverage. Medicare Coverage Database is the second link in the left column. What's one way to find it? A lot of people are like, that's too much. I don't even want to do that. If you just use the search feature and put MCD, Medicare Coverage Database, and my search feature just froze. There we go. And then you hit search. It will in the search items. right here. Look it up. It's going to be a popular one. Okay. Another option that you have is on the CMS website would be a favorite section. Scroll down. Top resources. Okay, what are you looking for? What are you looking for? Recent articles, all those different types of things. If you scroll down, the Medicare coverage database is sometimes listed in this area. The reason that it may not be today is what if people aren't searching for it as much today? So I just want to make you aware that it might be there as well. Okay, let's jump back. Let's talk about the coverage database just for a little bit because it is important that you understand this coverage database. You can search however you want to use the coverage database. That's fine. I'm going to search for visual fields and see if we have a policy related to that. Now, one of the things I want to show you with searching for this is it will auto bring up some of the different items on the bottom. Are you looking for an article? Are you looking for the WPS policy? If you select just visual fields in general, which is what I did here, it's going to bring up everything all together. So I got 41 total results. Some of these will not be WPS and some of them will. If you want to narrow it down, you can start with however you want to do that up at the top. So you can say, yeah, I'm not really interested in all of this stuff. Because remember, I said it's everything related to including the analysis, the coding and billing articles, everything. What happened with the CAC, the technology assessments, all that's in here. And you're like, I don't really want all of that, but I would like to just have NCDs and LCDs, and I only want final. I'm not looking at proposed right now. I want to know what's covering me current today. And then all local coverage articles. I don't really care about self-administered drug in this case, or maybe you do with visual fields. Response, I don't really want the response articles. No, a response article, by the way, is just the one that we wrote to say, hey, this is what you responded to on the policy. So it's not necessarily all that great, or I don't really care about all other. So you can leave it like this, and this would then narrow it down. If you then hit apply, it will bring your search results down to 29. Now you're like, okay, that's more reasonable. But you could also then add in a state or a contractor. Oops, I don't mean that. I mean your state. So let's say I want to do a state. Let's do the state that Karen sits in, and that is Nebraska. And we're going to say, okay, I just want to do that state, and it will bring up and tell you exactly what we have available to you. Okay, just give you a little bit of an idea. Here's the two that are actually labeled visual fields, but here's other ones where those results are going to show up. Okay. Now, when you go in, and we're just going to use this as an example, we're going to use the visual fields policy. Here's your, accept your CPT agreement. This just says that CMS uses CPT, so do we. So you're going to read your contractor information. It's going to tell you all the basic things. Key things right here, original effective date and revision dates. Okay. I'll show you more about the revision later on because the revision will be more on the bottom. If you want to know for sure that you're in ours, just read up at the top. It'll tell you the contractors and the pieces of information applicable. So thought I would show that to you. But again, this is where you're going to look for some of those basic pieces. Two of the key pieces I find are useful are here. I do like to bring down more information, and I like to look at where we're getting our national information. So what are we basing this policy on? This is the general section for the policies. This is the general section for medical necessity. Here's that internet-only manual, day-to-day operating instructions, and then you can go through in the Code of Federal Regulations. Then you will see this is the written information that is supported in the policy, not the coding and billing. It's just the written information. And you can see as I'm scrolling through, it's actually going to bring me through on this as well. So if you're not looking for all this stuff, feel free to jump down to whatever you want. I do always recommend start with your coverage guidelines at a minimum, because this is going to be the area where it talks about all the evidence that we used. What are we limiting to? Why are we limiting? This is the key to the policy. Sometimes general information is great. If you want to go ahead and read this, it'll talk about utilization, comments, maybe limitations required, things like that. So I think it's good information to definitely have. A revision history, some people like this, some people don't, but it'll tell you what was revised when, since the policy's been in play. Okay. And then associated documents. And you can see when you get down into some of this different stuff, this is where you'll find the information for the coding and billing article. So I think this is a great opportunity Now again, on the MCD, we did have the coding and billing article available right away without having to go into that. So let's take a look at it. What you notice so far is that I didn't show you any procedure codes. I didn't show you a diagnosis code. I didn't show you a modifier. Instead, I talked about a lot of information up here being written out. The billing and coding articles, remember the LCAs, we talked about these. So these are going to give contractor, same thing. Here's some information, look very similar. The biggest difference is once you start getting into some of the guidance, and we're getting down, I just got to get to the coding information area. There it is. It can limit things. Here's the procedure codes that are covered. Okay. Here's modifiers that you might need to know of for this type of policy. Then ICD-10s that will absolutely support. Okay, we don't even look at these. If you build this with a CPT code and a modifier appropriately, now again, appropriately being supported in medical records, right? We aren't even going to review it. Then it says, okay, what doesn't support? Well, it doesn't support it if it's not listed up above. Well, that makes sense. We also go on to give you more information if you bill on a UB04 claim form or the CMS 837I institutional transaction. Are there specific revenue codes? Are there specific billing codes? This case, there's not, but just in case there was. Okay. It just gives you a bunch of other information on revisions and then takes you back to the policy should you need to go there. So you can see all of the different comments that are listed. The reason it says superseded here is these were the original ones that are now superseded, which means you're in the most current one right here. These are older versions. So keep in mind, if something was effective during a period of time that you're still billing, this is why I chose this one. Let's say that you're going not quite a year ago, so you're in this time frame, you would want to follow this coding and billing guideline. Hopefully that makes sense. So this one is only for services 1/1/2024 and after. If you still needed to bill something older than that, you would need to go to the superseded. Same thing would happen in a policy, as an example. So the Medicare coverage database is full of information, lots of stuff going on there. With that said, I will let you know that this is where everything is stored. We do not store any policies on our website. We do link to these policies. I'll show you how to link to them in just a moment here. So again, as you're going through the database, feel free to move back and forth. Feel free to search, change your searches, whatever you want to do. There's a variety of ways you can search in different items that might help you. All right. That's the coverage database. Let's move on to the WPS website. One of the things that we get questioned on frequently is this code lookup tool. I will let you know that I am just on WPSGHA.com. This is our base homepage, it's our landing page, whatever you want to call it. This is a quick access. This is a quick reference. The actual tool is located here. This will do the same thing, but the difference is if we go to the tools and we go to the LCD and article lookup, our tools section does provide you with a list of just our LCDs. And this was one of the questions that I was asked. How do I locate just the list of LCDs? And this is where we're going to locate that. Okay. So hopefully that makes sense for everybody. And then you can go through now again, if you wanted to search an LCD and article lookup, you can do the same type of a search here. Actually, why don't we just use the same terminology that we just used with the MCD? And we'll use visual fields again. And what it will do then is limit down to just the WPS information. So it's two articles that we already looked at. So again, here we have this. One of the things that people really like this particular tool for is this section right here. It will list all the CPTs affected without having to go through and dig through all of it. It can kind of help you do that. What's great is our tool will also search by that. So if you have just a very specific NCD and you want to look it up that way, you can definitely do that. So let's just use one of these that would be within this visual field because I have it up. By doing that, again, it's going to bring up, here's your policy, and here's your coding and billing article. So a lot of people really do like this item for that purpose, and I think it's a great resource for you as well. All right, I'm not going to jump back over just yet. So I do want to show you one other question that people asked us, and I'm going to go back to the the WPS page. They asked about LCD information and where to find the most recent changes. I do like this all new section. specific types of articles. So if we scroll down, you will see proposed LCD open meetings. You'll see information, coding and billing articles, coding and billing articles, and LCD updates. This is just an example of one of what was changed. And if we open that up, sorry, I had to stall while I was opening it up. You can see it'll tell you exactly what we changed. Now, it's not going to tell you what changed within it, and you would still have to look this up by LCD number or by however you wanted to do that. But it is great because it will tell you what's retired, what was just simply changed, any of those types of information. So hopefully this will help you. If you don't want to go to the big list, you can always go to Topic Center and to Policies. And under this policies list, you'll see news and updates. It's in this gray area right under the header, guides, news and updates. And inside there, you will have the same news and updates. The nice thing about using this one is it does combine things quite well. So I do want to just spend a moment. I'm going to jump back to the CMS LCD guidelines. I'm going to jump ahead to slide 23 for those of you that are available. I think it's 22 in your list, but it's going to look just a couple different here. Yeah, we'll come back. We talked about this one. We're going to come back to this one, and it's going to look like this slide here. Policy page. And I just want to talk about it since I'm here. It'll make it easier. Then we'll jump back to the CMS and continue. So this policy page, one of the questions I got was, where is the LCD reconsideration process on the CMS? This is the LCD reconsideration process. It's the LCD and NCD reconsideration. The reason that it's an NCD is that if you scroll to the bottom of this page, it'll tell you go to the CMS website to look at the NCD reconsideration process. So, but otherwise it spells out the full LCD reconsideration. Okay. We're just going to scroll down here. You can see here it says go to the CMS website for more, and we'll go there in just a moment. Okay. So keep that in mind. All right. Let's jump to CMS website. And we're not going to actually go to the coverage database. We're going to go back for just a moment. And our goal is to get back to the base cms.gov website. And then there is a policy section. So again, you can imagine if you go to coverage, go to this coverage determination process right up here on the top. So you see me go to Medicare coverage and Medicare coverage determination. What's great about this is your general information slides. It's going to be your Medicare coverage determination page. Lots of information in here. You know, how to request an NCD. This is also how to request a reconsideration of an NCD. They do not use a different process. It is the same process. So if you want to learn anything about what we went through, I do think this is just a great opportunity to kind of come in, give it a go, give it a chance. We'll link you even to the information on the MedCAC, all of those different types of things that you might want to know. So I think it's just a great opportunity to look at all of this. Okay. Just kind of scrolling through there, and you can see there's just lots of different pieces of information. I do think it's a really valuable resource. So I would recommend taking the opportunity to look at that. Let's see what we missed here. LCD guidelines, NCD guidelines. So as I mentioned before, one of the things to be aware of is that we have day-to-day operating instructions that we do have to follow when we write an LCD. And so what we do is we go back to cms.gov, go to Medicare. What you're going to look for is called the internet-only manuals, and then you're going to look within those. Okay, so we'll talk about that as we get there. Regulations and guidance, manuals, internet-only manuals. Okay, then we're going to scroll down and you'll see a long list of manuals. I'm only going to show you the first page because we don't need to go beyond this. But the Medicare Program Integrity Manual. This is partially avoiding fraud and abuse manual. So 100-08 is the Program Integrity Manual. When I scroll down, you can see there's a lot of different chapters. Let's go to chapter 13. This spells out the full LCD process for us. So as a Medicare administrative contractor, as we begin to write them, whether it's multi-jurisdictional or single jurisdictional, this is what we're looking at. Hopefully this helps make a little bit of sense. Everything I went through in a real high level overview would be within this. So I want to make sure you're well aware of that. Okay. One other thing that people did mention is they're looking for education sources. There we go. Sorry, it took me a second there. I do like YouTube. I like our YouTube channel. We do post different things on LCDs. So if you're coming out here, you can search our YouTube channel. You can go to youtube.com, search WPS GHA. It'll bring you to our channel. Feel free to do that. I like using the playlist. I think it's a way to organize without having to go through all the different videos. Anyone that has been out there, you've seen a lot of videos. Once you do that, you can either search or you can scroll through. I'm not gonna just scroll through. I can tell you we do have the policy list here, but you can see we have different lists available. If you want to search for something in particular, feel free to search a list, try that. Let's search for Encore, just as a different option, because I did show you the policy list there. And it'll bring it up and it'll say, okay, here's some Encore presentations, but here's your overall list. This has 274 videos on it. You can imagine a lot of Encores. Along with that, though, if you wanted to say, nope, we're going to search the policy one, because that's what we're talking about today, bring up the different policy lists. And in this case, it brings up the policy list right at the top. Here's some specific information depending on the type of policy as well. So it's not just about necessarily LCDs, it's about different policies. And you can open this list up. The only question that we got relating to this section was just some navigation tips, and I already went through a bunch of the different stuff, so hopefully that answered those. If you do need more, let me know. With that, Karen, do we have any questions that currently came in?
We did get a question, Tom. Nicole wanted to know, what does retired mean? Is the LCD no longer in effect if it's retired?
Sure, that's a great question, and that is exactly what it means. The term retired is used to reference an LCD that we have we're not making changes to. We're actually setting it aside, saying no longer need to follow this guidelines within it. Now, we can retire them for a variety of reasons. Let me give you an example. We have an LCD and CMS writes an NCD. We will retire our LCD, but we may update the LCA, the coverage article, to reflect that. So it's really about the retirement of that, and it's going to be done. Now, it doesn't mean the coverage guidelines, especially within the articles, are going to retire. Two different things. Remember, LCDs can retire without the coverage article retiring, just depending on what type of article it is. But really it means, one, we no longer need it. We've got everybody on the same page. The data doesn't support the need for it anymore. It doesn't support the edits within the system. That could cause us to retire it. Two, a technology could change, which could cause us to retire it. Basically, that LCD is no longer in effect. Hopefully that answers your question, Nicole. If you need some more, feel free to ask. Any other questions?
We do not have any other ones at this time.
Thanks everybody for attending. We really do encourage you to give us that feedback. Give me the good, the bad, and the ugly. Remember, I really want to be able to meet your needs, and in order to do that, I have to know what you think. Always include any other topics you want, related or unrelated to the policy process, especially if they're new to Medicare. What would help you, your organization, or someone new? Review our lab events page for registration. We're always posting new things, so take a look at that. Don't forget to watch those encores if you're interested. Check out our YouTube channel. Big old list of those. I showed that to you. On behalf of myself, Karen, all of Provider Outreach and Education, and WPS, thanks for participating. We look forward to your survey comments, and I hope that you have a great day.